All right. Good evening, everyone. I like that call and response to start off the show. Thanks, Jonathan. Welcome, everyone, to the Lenox Hotel and to this installment of the Bomber Entrepreneurship Network. It's an event series that we host for Ithaca College family members, alums, friends, former and current parents sometimes make their faces shown, and of course, current students also are welcome to be part of this network of folks that are hungry for new ways to delve into the entrepreneurial spirit and find success in whatever they do and whatever passions grabbed them when they were a student at Ithaca College and now off South Hill. My name is Brett Bozzard. It's my privilege to serve as the Senior Executive Director for Alumni Engagement at the college, and I'm also, thank you. I'm also an alum, class of 95. Okay, there was one for that. That's good. I don't know what I was expecting, all its calls and responses, but thank you. I appreciate it. Makes me feel welcome here in Boston. We have members of, while this is an entrepreneurial event, so it's hosted in conjunction with the School of Business and the Division of Advancement, we have students and alums from all 5 schools represented here tonight, which is fantastic. It shows the core principles of theory, practice, and performance at Ithaca College that go across all curricular interests and all professions that people find themselves in after they leave South Hill. So thank you all for being here. You already have had a chance to network a little bit, meet each other. I want to remind folks, hopefully you saw the QR codes around the hall as you were enjoying some food and drink. We have a brand new alumni online engagement platform called IC Alumni Connection. It's at alumni.ithaca.edu. If you scan that QR code, you'll be able to claim your profile, create your online personality and persona for the Ithaca network, and find ways to connect with fellow bombers all around the country, all around the world, actually. The map function is very cool. It's got a heat map so you can see where folks are and find the next new friend you didn't know you needed wherever you end up traveling to or landing after you leave South Hill. So please check that out. This event has been going on now for the last three years. This is the 3rd year, and each time we hold one of these networking events, we do it in conjunction with the Meet the Firms program, which is something that the School of Business organizes, but as I said, includes students from all the schools on the Ithaca College campus. It wouldn't be possible without the verve and talent of Jonathan Chalmers, who's a career engagement specialist working out of the School of Business, so he's our guru when it comes to finding sites. So for those alumni that are in the house today and tomorrow, the students who are here in the house will be visiting sites all around Boston, and they're here to learn about sort of entrepreneurship and the business of health and wellness. So you'll see that theme will be coming up throughout tonight's program, so stay tuned. Also in the house tonight, we've got faculty and staff from the college at Cato. A professor in the School of Business is here. Of course, our members of the Alumni Association Board of Directors. We've got a couple of those. If you want to raise your hands, folks, we've got members of there here. If you want to learn more about how you can volunteer and be part of that group, please ask either of those folks that had their hands up. And we also have the vice chair of our Board of Trustees, Chris Palmieri, class of 96, is here tonight, so thank you for joining us, Chris. And one of our men of the hour is the dean of the School of Business, Michael Johnson-Cramer, and he's going to take over the podium and get this program started. Thanks for joining us.
If I can, thank you. Good evening. Have a seat. Evening. I love that. Thank you for that. After a long drive out from Ithaca, that's fantastic. So Brett has been just a wonderful partner in now the 3-year history of the Bomber Entrepreneurship Network, and a number of folks from Alumni Affairs, Alumni Engagement, but especially Brett, are in the room. So can we give them a hand for organizing this as well? This is just fantastic, and thank you for being here, the alums, the broader community members, as well as I love having the Meet the Firms trip here. This theme has been on my mind since we first started the Bomber Entrepreneurship Network. I lived up here in Boston before taking the role as dean at Ithaca, and I worked in and around the various spaces that business schools work in here, and worked with healthcare organizations, worked with finance, State Street and Fidelity, and brought some of those experiences to Ithaca. But when I got there and started partnering with the Dean of Health Sciences and Human Performance, it was such a natural conversation to say, what can we do in the business of health, the healthcare space, thinking about health and wellness broadly, and really bringing together under the umbrella and the rubric of entrepreneurship. So it was a natural when we were sort of coming back to Boston after having done our inaugural event up here a couple of years ago at the Harvard Club, to return to wanting to sort of emphasize this theme. And the nice thing about being a business school dean for 12 of the last 15 years and being in sort of academia as an educator for a good amount of time is that you kind of dream up ways of connecting parts of your life. And I thought to myself, one of the great things about being somebody who studied business and been fascinated by entrepreneurship for so long is that there are a handful of people in my life that have shaped my understanding of business, and one of them is sitting with me on the stage tonight. So in a lot of ways, Bob, Delise, and I have had a conversation about healthcare and the business of healthcare that has lasted decades. I have learned a ton from it, and so as a dean, it's my great privilege, especially for the students in the room, to say, hey, let's have that conversation in front of some people so they can learn from it too, and start that conversation well. Now, the trick to these Pharma Entrepreneurship Network events are that you have people at every range. We've got students in the room for whom healthcare and entrepreneurship are just sort of the title on this thing they've decided to look at in their very first semester. How many World of Business students in the room? Do we have anyone? Nice, we've got 2, 3 World of Business students. That's our introductory business class that happens in your first semester. So we've got everything from people in their first semester to people who've spent their whole careers cultivating entrepreneurship, helping and supporting entrepreneurs. I see you, Bobby, and who have just made huge impact in the entrepreneurial space. We have folks who've made huge impact in the healthcare space and in the wellness space broadly. So thank you for being here. And without further ado, I want to start with a very simple question. So, Bob, for the students in the room, it's hard to imagine the journey that takes them from their seat to your seat. Can you just give us sort of the milestones of that journey so that we get kind of the lay of the land that you follow?
A very simple question.
Yeah, exactly. That should take us through to dessert.
First, yeah, right. First, just by way of introductions, hi everyone, really nice to meet you. My name is Bob. I am a consultant by training, a management consultant. I have been doing that my whole career. During that time, I have been part of the founding of 2 consulting firms. What I do in general, because people go, what is consulting exactly? My specialty is with healthcare product companies, mainly pharmaceutical, biotech, some medical device firms. If I really focus, I help new drugs in cancer and autoimmune disease figure out how to get to market. Right? And that's, I can talk about different things that I've done, but that's really sort of my professional knowledge. So you asked how I got on this journey, and I'm going to focus on those of you in the room who are in college right now, right? I started knowing I wanted to be in consulting. I had friends and family who were in it. I said, that sounds like a really good career. I think I was right because I stayed in it for 30 years, so there's probably a good choice. But when I came out of college, it was a recession. Consulting firms weren't hiring. The whole idea of saying, well, this would be great. I'll go and I'll work for Deloitte or McKinsey or some other firm with a big name and I'll get that. Yeah, that was dashed pretty quick, right? It was the middle of a recession. I searched really hard for a job from January of my senior year until maybe September after I graduated. 80 rejection letters along the way, everything else. I couldn't get a job to save my life, right? And I think part of the journey that I will sort of share with you is falling off what you think the right path is actually a way to create new ones, right? So what I ended up finding was a consulting firm that was sort of like just getting started. It was a few years old, and they were hiring their first college grad, right? And so I became employee 6 of this consulting firm. And at the time, there was a manager who had just started, and he and I we connected, right? And it became a good thing. I started working as his associate, doing the work for him, eventually grew up a little bit and became his manager of projects and things like this. And we grew that 6-person firm to about 25. Long story short, that manager left and formed his own firm. I went with him as employee 2, right? So I was 26 when I helped to found my first consulting firm. So it's not that far off from where you are today. Worked and helped grow that firm to over 100 people over a 12-year period, right? During that time, we were successful. We actually spun out a couple of businesses that had to do with data related to pharmaceutical companies. And in the end, I left to form my own firm, which I did in 2009, right? And that firm, I also grew for about 12 years. And then in 2022, I and my other partners, because I took on some partners along the way, we sold it to a larger firm, which is the largest firm I've ever worked with. It was 600 people, right? It never really got above about 105 in any of the other firms. And so now I work for a larger consulting firm that's multinational, a lot of people in Spain and Switzerland and everything else. And essentially, our firm became the US team of a more European firm. So that's my career. That's 30 years in, 2 minutes?
That was great.
Something like that.
So while we're talking about sort of the career pathway and journey, there are a couple of moments in there, and you I remember some of those moments, especially when you talk about the moment, when you left Putnam first,
First, okay.
And then
when I was a child.
Exactly, and then you moved to becoming employee number 2. But all the way there, you've made it sound very sort of mild-mannered, but there's a lot of risk built into that. How do you think about risk along that journey?
Yeah, it's a great question. I think part of this is because I took a path a little less traveled, right? Smaller firms, it became sort of natural to me, right? When you're working in a small firm, you do not have the support that you have in a larger firm. It's great to work, whatever industry you're in. If you want to go and work in communications, you work for a 10,000-person firm, there's a lot of things you can learn. To be an entrepreneur, I think you need to experience what it's like to work in something that's less than 20 people, right? And in that sort of thing, the risk is what it is, and it's just sort of natural for the part of the thing you have. I do want to make a point which makes me a little different from other entrepreneurs, and I'll come back to this maybe later in the conversation. The typical entrepreneur's path is you have an idea, you go find money, right? You go to a venture capital firm, private equity, angel investors, whatever it is, but you get some funding and you give those investors part of your business, and that money helps you grow or fund the thing that you need to do. Something that's unique, I've been in a professional services industry. My business is people, right? It's myself, it's other partners, it's junior people, it's the brains that we have and our ability to solve. I don't need capital equipment. I don't need, some of my clients are medical device firms or biotechs. I need to run a $10 million clinical trial. There's nothing like that I need to do. I did this all without venture funding. So that makes me a little bit different, and that does change my story a bit. The typical entrepreneur, the first and foremost thing you need to be able to do is talk to investors, right? I will talk about that a little bit because one of the things we've done is consulted to companies who are in that stage in biotech and pharma, and actually we've spun out people who've joined my company, learned a little bit, and then went off and founded their own, and so I can sort of talk to that experience too. But I think that's another piece of this, and when I talk about risk, part of it is when you're funding it yourself, boy does the risk feel risky, right? There have been times where I've found like a really good person. I say, this person looks like they'd be a really wonderful partner, right? And I've hesitated, and in many cases I didn't move forward. They probably would have been great, and I've seen them been great as they go on with their career, but if you invest in somebody to senior level, that is our risk taking, right? And going and sort of buying that person's, talents and that sort of thing by spending, you have to invest them hundreds of thousands of dollars to be able to do it, and that has to come out of your own pocket. And so it means that one of the things you do is you're super careful. You only hire when you have the work, right? So you sort of sell the work first before you hire. It also means that when you're thinking about that kind of thing, it makes a lot more sense to bring people in at maybe a more junior level. It could be right at the ground floor, it could be as a manager. Invest in them so they want to stay, give them opportunities so that they have the opportunity to grow into your new partners. That's a much more safe way to sort of manage the risk. And that's true, and I'm going to say any professional services firm. It doesn't have to be consulting. It could be PR, it could be advertising, it could be accounting. Yeah.
So when you made the shift, and this is another one of those risky moments, but you're working for Trinity Partners.
Yep.
You're in great office building out on 128. Coming around.
Fancy. Yep.
Coming
Okay.
around.
Yep.
You were fancy. You're flying all over the East Coast anyway, and the world and everything else. Take us to that decision to found Artisan.
Yeah, there's a lot built up in there, right? So first, Trinity was the firm that I mentioned that I joined and helped found when I was 26. I was there for 12 years, part of the leadership team. After 12 years, you start to get a little restless. So there is that to say, okay, am I going to do this my whole career, or am I going to do something else? Always liked the entrepreneurial piece, and it felt big. It was 100 people. I know that's not that big in the scheme of things, but it's the biggest I'd experienced. And there was an inflection point within the firm. There was a leadership change, and there was also a sort of direction of the firm change. That the direction of the firm change was we started focusing on more what I'll call cookie cutter work, to say something that you can deliver with a bunch of junior people, right? And you can deliver it over and over again, kind of doing the same thing. That wasn't what I did. I was a strategy consultant and needed sort of the sophisticated MBAs and people who could maybe have more than a few years' experience. And so the hiring and the way that the firm was organized really wasn't fitting my business. And so it felt like the right time to move. The third thing that happened, and those of you, I see alumni in the audience too, if you remember in 2008, there was this investment bank called Bear Stearns that went bankrupt. And crisis is always a good moment, right? So when that happened, the industries all sort of got shocked, right? And our clients, pharmaceuticals, biotechs, they were very, very worried about money. They stopped spending on consultants. So it became a time when the firm itself was going through crisis. And it's a weird thing, this is going to sound backwards, but in professional services, in a consulting firm, if you're responsible for revenue generation, you've got to bring in revenue for 20, 30 people, right? In a weird sense, that's an excellent time to start a business because I just had to worry about myself at first, right? So it's easy. If you're working and sort of making sure that 20 people have things to do, and instead you just have to worry about 1 or 2 or 6, God, a recession's a very good time to do it. So anyway, those are some of the things for me.
Take us through, so in shifting to kind of healthcare, when we teach entrepreneurship, we start, as you said, with funding, then we get to market idea and sort of how do you think about marketing and how do you sort of define product. But healthcare is different, and you've convinced me of that over the years. Talk to me about how marketing translates into the work that you do with your clients.
Fair. I'm going to sort of say first, for healthcare, healthcare is big. There's lots of places with it. I focus on healthcare products. I don't work with hospitals. There's so big things. You could work with hospitals, doctors. You could work with payers like insurance companies. I work with products, mostly biotech companies, pharmaceutical companies, newer technologies like cell and gene, sometimes medical devices. And when you're an entrepreneur, you're starting something new. You have a new idea, right? One of my old colleagues who worked at my firm for 7 years, went to business school, met someone in business school who was in a PhD program who had a technology. And the two of them went off and founded, instead of getting a job, they went off and founded a biotech. They founded a next generation gene sequencing company, right? So here, you don't have a product yet. In fact, he's now been doing it 3 years. He doesn't have a product yet. In fact, he hasn't entered clinical testing yet. So your marketing at this stage is what I was speaking of before. It's about getting money, right? You start with, in his case, he started with $10 million, right, that he got from venture seed rounds and other things there. It gives you enough to get through the next 2 years, maybe 3. So your job is always marketing the technology you have, the capability, and being able to envision what it looks like in the future. And your customer is that finance group, right? Who is going to give you the next round of money? Will it be an up round? Will it be, instead of $10 million valuation or investment, will the stock go up 3 times and therefore the first round is happy and so forth? But you're constantly selling the vision of your company, and you're doing this in this very strange, like foggy way because you don't have a product yet. You're envisioning what this product could be, how you can get it there cheaply, the tests that you can do, you have a clarity of path, and so that's what you're doing for marketing at first. Real marketing comes when you have a branded product, right? They may be 10 years away from that. So that's actually not the entrepreneur's job. Yeah, I heard somebody go, yeah, 10 years is about right. So you have to get funding for 10 years, and it gets bigger and bigger and bigger as the trials get bigger. So it's really about that money, and then also maybe convincing physicians of your vision so that they want to enroll your patients, in their patients.
Interesting.
Yeah.
So, or you can do Theranos, right? And invent it out of whole cloth.
Yes.
So that's the
They don't do that in Boston.
Right.
That's a San Francisco thing.
We were talking about this backstage, that Boston's a much more careful kind of scientific venture market compared to our tech colleagues on the left coast. Yeah. What advice would you give to, if you were, sitting down at a bar with a friend who was going into healthcare entrepreneurship, who was really, in a moment when the industry, as you say, the whole sector, which is complex, and we're sort of eliding that, what advice would you give? Yeah.
I'm going to try to make this more generic advice that could apply for someone 10 years out of school and someone who's graduating now, right? I think the first thing is, you, early in your career, should be preparing yourself for the things that you'll need to do as an entrepreneur. As an entrepreneur, you have to be CFO, you have to be chief marketing officer, you have to be chief window washer, right? You've got to be able to do all of it. You've got to manage people. You've got to build a culture, and you have to have some knowledge that someone is willing to invest in or to buy, right? And so the first thing I would do is build that knowledge, right? And you can do that anywhere. You can do that in a particular role. You can do that, but what I would hope to get is real experience in an industry you want to do, and I'd hope to get managerial experience. I'd want to know how to manage people because you're going to need to do that, and no one's going to teach you once you're a CEO. I think the other big piece of advice I'd give is, when you do it, the world, and this is a real thing, the world falls on your shoulders, right? If you don't raise that money, people lose their jobs. If you don't sell what you need to sell or generate a project or whatever it is, then the people you thought you hired to be ready for growth, you have to make some really hard decisions with them. And you feel that as an entrepreneur in a way that I didn't when I was working for a larger firm. I mean, I ran a P&L, I did different things like that, but you don't feel it in the same way where it lands on you. So you've got to be ready for that. It's got to be something that you thrive with, right? So there is a personality type that can be learned, but it is a personality type and a thing you need to be ready for, because we all sort of feel that from time to time. The buck stops here. Yeah.
This is something we actually haven't talked much about, but this last period of your this most recent period of your career, and I had to promise Bob, we've got Chatham House rules. Don't live stream this. Like what gets said during this segment stays in the segment. Yeah. But you sold Artisan to a global company, Alira, and you've stayed on. So all of a sudden you've gone from a career of being employees single digit to sort of a place that does have investors, that does have financial pressures, that's part of a bigger entity. What's that been like for you?
Yeah, so I'm going to talk two ways. Briefly, for me personally, it's been both a very different experience, but also fascinating, right? The different experience is I've been used to being the decision maker, right? Now I'm part of the leadership team of the consulting firm, which is great, but I have people that I have to convince. I have people that have different agendas. I have all the things that I've been helping my clients negotiate at their bigger companies to say, how do I motivate and influence people, right? And I'm living that. Okay, so it's a difference, right, from that standpoint. I think the biggest difference is, remember, I went through a career where during my entire career, I never had financial investors. I never had that. This is a firm that was founded, actually, the two founders basically bought another consulting firm by going to a French billionaire and saying, I want to buy this, can you fund it for us? So they've always had private equity or family funds or things like that in it. And it is a very different experience. They have to be managing with the board. The board has investor returns, so where I could play the long game. Basically, I could make decisions that could help the partners in our firm. I could make decisions that said, hey, this is going to help us grow, and I'll invest. There's definitely a need for returning profitability and a short-term view. So I think that's one of the hardest things, is trying to make the investments that you need in people, in growth, and other things, where there's also, and again, there's sort of the joke of pre-revenue versus post-revenue. Like, if you're a firm that all you're doing is burning money and you're getting firm, you have a little more leeway. This is a firm that has revenue, and therefore it has profits that it needs to hit. And boy, when it doesn't hit them, stuff happens. So I think that's the biggest difference. It's fascinating to watch, but it does very much drive a short-term mindset.
Yeah.
Yeah.
Yeah, that ability, because I think when I've watched your businesses grow, that ability to say, we're going to keep these new hires on through this dry spell, because we know that we're going to come back from this moment. That's been a great long-term mindset as you build these companies.
And it helped. What Michael's speaking of is there have been times when we go through recessions, we go through downturns, or a big project got broken or whatever, and we made choices not to lay off people, right? And I can tell you that in my 30-year career until year 27, I never did a layoff, right? But in this environment, especially we're not in a positive environment out there now, right? When you're not the decision maker, I don't have that luxury to make the choice. And so, yeah, it's sort of part of the larger business and part of something that has a short-term focus.
So
yeah.
The three world of business students have heard me lecture, and they've I know, right? And they've heard me at least once say something probably somewhat cavalier with the statistics, but it's roughly to say, many of you will want to major in finance. That's fantastic. Financial services is 10% of GDP. What a great thing for you to go into. Healthcare is 20% of GDP. Like, how can I pitch you on the fabulous opportunities in the health space broadly written? I don't feel like you need to convince us of that, because there are some really experienced
healthcare
healthcare
entrepreneur
folks.
group, right?
Yeah, exactly.
So
But I do kind of want to hear, because you have devoted your whole career, not just you could have done management consulting and in any industry, in any space. What gets you excited these days about healthcare, that you still get up in the morning and they are really excited to work with your clients?
Thank you. I get to see at a very early stage what is going to happen 10 years from now. And sometimes it's incremental. Sometimes you're like, great, I have a drug that are going to make my psoriasis go down. Now they go down 70% when you take a drug, it's going to go down 80%. That's great. It's a nice improvement. I have seen drugs where, and in fact, I remember very clearly one of the most powerful moments. I was in a room at a large pharma company. We were reviewing something that had just been tested in its first 10 patients. It was a new type of therapy. And it was for a disease called malignant melanoma. And at the time, the median survival after diagnosis with melanoma was 9 months, right? This drug had been tested in, I think, 10 or 11 patients. And it had been tested in all of those patients had started their therapy at least 10 months ago. Every single one was alive, right? So you get to see that, you get to see it at its early stage, and you go, wow, this is going to change lives, right? And I will tell you, that was 15 years ago. There was one that we worked on. We funded, or my client, we sort of helped sort of think about it, but funded there's a big New York cancer hospital called Memorial Sloan Kettering. And there's a physician there that said, you know what, I could take one of these drugs that work, that we save for late disease, right? And rectal cancer is a horrible thing, right? It's something that, can kill you. You get surgery, which is equally horrible. I won't bore you with the details, but you can imagine what we're talking about here, right? And so she said, what if we gave this therapy before surgery and see what happens, right? And then afterward, we'll give surgery. So here's the thing. They put 30 patients in a trial at Memorial Sloan Kettering with this drug. And we decided to fund it, as part of the decision. So I think this is a good idea, let's go. And so when she came back with the results, all 30 patients had the tumor go into complete remission. They never needed surgery. They're all still alive. They've not regressed. So it's advances like that. That's why I'm in it.
Yeah.
So
I'm going to give the heads up to folks. We're going to shift to audience Q&A after this last question,
okay.
but be thinking about that. But the question I'd have for you is, when you look at opportunities in this changing landscape, what are the opportunities in healthcare right now that you get excited?
As an entrepreneur?
Yeah.
So I think there's a bunch, right? So I'm going to, in fact, one of the things that's nice about having a small firm that has an entrepreneurial mindset is you sort of help to foster and grow new entrepreneurs, right? So I'll talk about two that I think give you the range of things. So one I've mentioned before, I had a person that I hired out of college. He stayed with us 6 or 7 years, became a manager, went to business school. He had a friend who he met there who her technology was, I won't bore you with the science, but right now there's a way to do gene editing that there's 3 or 4 billion-dollar companies that have been doing it. And they cleave double-stranded DNA, and it just sort of covers a small clip of this. So you can take a small portion out. So they have a technology that's next generation. It's a single strand of DNA that allows you to basically copy-paste very large sections of DNA. So it enables a whole bunch of different sets of drugs. And so the two of them went out there, he wrote the business plan, he started pitching investors and doing that, and he had a $7 million term sheet in the first 6 months, So opportunities for new technology come all the time. You need a scientific bent for that. But I'll give you another one. And this one is going to pivot from healthcare, so apologies, but this gives you a sense of sort of how these things sometimes don't go the way you think. Different manager, left, and her sister actually worked for Apple, right? She was a really good tech programmer. She had worked on Apple Maps, those kinds of things. And after she left, she said, so let's talk, Bob, I have this technology, right, that my sister and I have made. The sister's made it. I'm trying to think of what to do with it. Basically what you do is you take your phone, you put an app in your phone, and you circle it around your body, and it takes a very accurate 3D map of your body, right? And she was like, I'd like to pitch this to plastic surgeons. Right? Interesting business case. So what can we use it for? Can we use it to say, hey, if you're going to do some sort of reduction or augmentation or change, this is what it will look like in your body? I said, yes. Honestly, at the end of this, let's do the business plan. It's not that big an opportunity. So she pivoted, right? So her company is called True to Form. And so she did this in the best possible place she could do it, custom women's clothing, right? And she won Entrepreneur of the Year in Chicago, in terms of the business model. She's connected with 5 or 6 major women's brands, and she's starting to deliver tailored, all coming from technology she thought would be useful for plastic surgery, but you adapt. You figure out what the right business is. So there's, and again, I could go on for different things, but I think there's so many opportunities. But that one I bring up because digital health and wearables and other things like that, there's so much happening there now, and there's so many reimbursement restrictions and other things that happen, but you get it right, and that's something that unlocks a whole bunch of things.
Fabulous.
Yeah.
So we're going to flip to questions from the audience. Yeah. We have a microphone, and I will ask, because we've got the video going, if you want to ask a question, please, we can either pass the mic. Do we mind passing the mic around so that we capture the question on the video?
Yeah.
Be awesome. Questions?
Yeah. Nice.
Thanks for being here. My name is Yashawn Clark.
Hi, Yashawn.
Class of 2022. Lucky to be in the Park School. I'm happy to be here. I have 2 questions. One is, what advice do you have to current students who are looking into getting into the workforce with the pressure and the hindrance of employers wanting someone with experience already. How can you make yourself a little more valuable and desirable to employers? I know for myself, that was a very tough hurdle to overcome in the marketing field. So that's one question. My other question is, for students who are kind of in the field already, I know in consulting there's been a lot of layoffs because of like AI. How do you get around that curve? How do you beat the curve? How do you make yourself
As
more
a student
desirable
trying
as
to be
well?
hired. Okay.
Right, yeah.
No, I think this is a great question. And I think that has been a story as old as me, right? Like that, yes, you need experience, but I can't get experience where you do. You will hit rough points, you will hit places where you think you're going to get something and you fall off. You just keep trying. The idea is to get that experience, right? It doesn't have to be with the most prestigious firm. It's, I think the thing to look for, it could be a small place, it's a large place, but look for someone or a place that will mentor you, right? I think the biggest thing is, I remember being in the position, maybe not of you who've been out a few years, but in that sort of college senior who's looking for a first job, and they all seem so professional in this and that, and I had no idea what I was looking for, right? I knew what I was looking for, I had no idea how to evaluate whether this was good or bad. Right now, if I were in that position, I would be looking for a few things in that interview process, so I'm going a little bit off, but I think this is helpful for these guys, that like, first, I'd be looking for, are people talking about how they're having an apprenticeship model, or that it isn't just you're there to work and do what they say, but also how are you learning on the job? The second, I want to see people who are more junior that kind of look like you in the interview process. Even if they're like shadowing somebody else, like they come in with me and I've got a 24-year-old colleague in the room who's sharing the interview, I now know that I respect that 24-year-old enough that, okay, I'm probably going to teach them something or do something with them. So find the opportunity. It doesn't have to be the classic opportunity you're looking for. Don't worry about the money initially. You have to worry about the money to live. I get it, right? But don't pick the job that necessarily pays $5,000 more if you see another job that will give you that apprenticeship, because the job market and your career is a long game, right? So I think that's your first question. That's my answer. And the second was the AI and consulting is hard. Yeah, you're right, by the way. It's rough out there. It's not just AI. It's also that a lot of the firms out there are having difficult economics, and when they do, the consulting budgets get cut, and so there's less need for consulting. We still need an apprenticeship model, right? Consultants grow by having, every year our associates, some of them grow to be consultants, some of those grow to be managers, some of them grow to be partners. If we don't hire someone at that junior level, and I say this understanding our hiring is down this year, right? But if we don't hire someone, then we don't have the bench. We don't have the farm team, right? What we're looking for are people who can adapt and can think creatively on their feet in interviews and in general, right? I don't need a set of pre-learned knowledge. I need somebody who can react in an interview and react in a job setting to figure out the answer to the problem and be unafraid to do it, and be unafraid to learn, right? So those are the things you're looking for. I also will say, being a consultant, I will tell you, consulting is the best career you could go into. It's not the only one, right? There are plenty of ways to get to that. You can go into primary research, you can go into PR, you can go into a scientific field. There are all sorts of things that, depending on who you are and what you are, might be equally good as a path. I had one friend go and be an audiologist. He actually got like a PhD in hearing, right? And he became a consultant, and then he became a vice president of a company that basically treated hearing. So there's different ways to get there, is what I would say. And you will get knocked off. There is very few people who go through a career and everything comes up like, roses and unicorns and everything else. It's what you do when you get knocked down that really, I think, makes the difference. So Sorry if that sounds too motivational, but so, yeah. Mm-hmm. Yeah. Others, please.
So I noticed during your presentation and the talk, there weren't a lot of women mentioned
Oh, yes.
until you got toward the end.
Yeah.
And there was a lot of he. Not laughing, but
I'm with
male
you.
folks.
Yeah.
And less than 2% of all funding goes to women entrepreneurs.
Yes.
Women-founded companies get a very, very small percentage of the funding.
Yes.
And I noticed as well that you had a male-female combo for one, and the guy went out to do the funding, and the woman stayed back and did the technology and the science and things like that. So I'm just wondering if you had any opinions.
I have all sorts of opinions. This is a good question. First, can you tell me your name, please?
Bobby Carlton. I'm the founder of Innovation Women. It's
Oh,
a
wonderful.
Speakers Bureau for
Excellent.
women.
Very nice to meet you, Bobby. Excellent question. All right. I'm going to start, and thank you for bringing this up. I think there's two things I will bring up of what I've said already, then I want to go back into history, my own history and journey, right? The first is the two examples I gave, right? One was a man and a woman, and I am going to say if you think that creating a single-stranded DNA technology is the easier job, the sort of less, like, this company doesn't exist without her, right? It's really nice that he can pitch for her and he's got the background for it, but let's be honest, she's the CEO, he's the chief business officer, right?
But don't you think that
Yeah.
But would she have gotten the same amount of money if she had been out pitching?
Well, had she done what John had done in terms of a career, I would say heck yes. And why? Because then my other colleague that I said, two sisters, right, Janice and her sister, they went out, they got some venture funding, they went out and they got partnerships with everyone. That is the consulting training of saying, do I understand the business and what it takes and how can I tell them make a marketing plan and that kind of thing. I'm going to go back because I love your question, right? And I think I'm going to go back, my very first client, so I was a 12-year-old child, I think, you know, but like my very first client was really, I had the good fortune of working for the first biotech company. And they were launching a drug, I won't bore you with the details, but it made red blood cells grow. It was a part of Johnson & Johnson. And Johnson & Johnson had different operating companies. And we worked for the company that had the first woman operating company president in J&J's history. This is back in the early 90s. Carol was a role model to me, right? And so I learned a lot from her leadership style, right? I learned that women's leadership style can be different than men. It can also be very, very both demanding and nurturing at the same time, right? And she was a fantastic model to have. As a result, I have always had companies, I think, that have leaned more women than men, right? So I said he in some of these examples. Also not laughing, because I think if I think about the makeup of my team today and my company before I sold it, it was probably 60% women and 50% non-white, right, from that standpoint. That is what I think a firm should look like. It's that I think we need people of all types, right? I think we need people of different mindsets. I think we need people of different experiences, life experiences, and that creates, I think, an environment that's healthier for all. In terms of funding for women, I've not worked in finance, so I don't have statistics or details there, but I've watched one of my old colleagues, Michael and I were talking beforehand about who do you hire first, right? And I hired one of my first associate out of college hires was a woman who was convinced that she wasn't going to be a consultant, she was going to do something else. She ended up becoming, of people that worked for me, the first officer of a public company. She became CFO of a vaccines company, right? And so I think that nothing I'm saying here isn't applicable to women and men. I think that I would go for it across the board. And I do agree with you that there is a funding gap and that there is still bias in the system that I think we should all think about and work to erase.
Other questions?
Thank you for being here.
Thank you.
My name is Annabelle. I'm the Assistant Director for Young Alumni and Student Engagement at IC.
Nice to meet you.
I graduated in 2025 from IC with a marketing degree, and I've had some experience working in sales. and it was one of the most unethical times of my life. Literally, I did not know that in some sales sectors, they don't care so long as they look good. And I worked for a huge company. Anyways, how do you handle the mistrust that comes with marketing and healthcare? Because there is a certain level of mistrust when it comes to healthcare, period, amongst certain people. So what does, I guess, your role, what do you do to kind of ensure that you are ethical and also not not feeding into the mistrust that many people share when it comes to healthcare?
Thank you. Annabelle, can I ask, what industry was the sales in? Was it sales of food products? Was it sales of pharmaceuticals?
It was sales of the American experience. So it was a travel exchange program.
Ah, okay. Thank you. So I think the short answer, and the answer that will help you be true to yourself if you choose to stay in a career that is sales, which you may not, right, is that you need to find firms that are ethical around it. And in your career, you need to strive to be ethical for it. That means not sell something that you know is not to be true, right? If you find yourself in that sales culture, my strong advice to you is get the hell out of there, right? So there are places that are not like that, right? I will tell you, my job as a partner in a consulting firm or a president of a consulting firm is to sell. I never think of it that way, right? My job, and this is sort of how to make ethical sales, my job is to solve problems, right? I have a client, that client needs to figure out which, my sales are going down, I'm not sure why. What I'm doing is I'm helping to solve the problem before we're hired, to just show them the credibility of things. I'm not trying to sell them, oh, we're going to be great, and here we go, and then I hand it to somebody else, and that kind of thing. In my industry, so you could be talking about drugs, I will say that medicines, there's a lot of mistrust around that, right? I think that's very true. I'll go a step further. Something that's been a big cause of one of my clients that I've helped work on is fairness in clinical trials. Remember I talked about new drug development? Well, it turns out that, sort of going back to Connie, is it Connie? Bonnie in the back? Bobby, I'm sorry, Bobby. To her question about funding, if you think that's bad, try clinical trials and non-white subjects, right? So one of the things that I have helped work on with several companies is to say, how do we change that, right? And so one of the things that actually makes the difference in sort of mortal diseases is access to clinical trials. It's where you could get lucky, hit the lottery, and say, this is something that's not going to be available for 5 years, but I got it. Doesn't always work, but if you're, frankly, rich and white, it's more likely you're enrolling in that trial, right? What we have been doing are strategies like outreach to centers and hospitals that are inner city, an identification of young physicians who are up and coming, who are in those communities, they're non-white, they're leading things from a different direction, and reach out to them, but also education in communities. And there's fundamental mistrust, right? It's not just like, hey, go in and say, clinical trial is great, isn't that nice? I've worked very strongly with, there's a wonderful charity for breast cancer called Tiger Lily, right? Tiger Lily was founded by a Liberian woman who at 26 got breast cancer in the United States, and she was lost in the system, right? She had misdiagnosis, everything went wrong, she trusted no one. She figured it out on her own, and she said never again. And so she created what is now a $20 million charity, I think, with a group of people who are generally from poorer communities who educate peer-to-peer, right, on what it is to sort of basically promote yourself within the healthcare system, right? That's how you build trust, right? It's that kind of thing. Just me selling you something and then walking away, that's bad. So Annabelle, I'm super sorry you had a bad experience. I think you did the right choice and got the hell out of there, right? It doesn't mean all sales are bad, because sometimes it is solving a problem, but be careful, because all that stuff's out there. Yeah.
And now you're at IC, and that's awesome. Really, so
Okay,
much
don't
better
change.
for
Even
that.
better.
Yeah.
Yep, very good.
Pillar of ethics.
Last question.
Yeah. Yeah.
I loved hearing you speak about trials, like the successes, the shifts. Do you have any like favorite books or journals about like healthcare innovation?
Oh, healthcare innovation books. There's a very old one that I loved, but it's dated now because it sort of chronicles the 1990s, right? It's called The $1 Billion Molecule. And that was about, there's a company here in Boston called Vertex, which is now a global multinational company. One of the companies it talks about was the founding of Vertex. So it, more than anything else I've seen, really captured, because I was part of that sort of 1990s emergence of the Boston biotech scene, and I think it captures that now history better than anything else, right? I've worked a lot in cancer and in blood cancers in particular, and if you can stomach it, because again, it's not an easy subject, there's a book called The Emperor of All Maladies. Emperor of All Maladies, I have to say it right? But which is about blood cancers and the evolution of it. I think that's been a fabulous one. It's more scientific than it is about healthcare innovation and things like that. I'm not a big reader in sort of the nonfiction world, you know, some of these chronicle things, so I don't have too many along those lines, but those are the two that stand out.
Thank you.
You're welcome. Yeah. Oh, sorry, can you tell me your name again?
Elle.
Elle, thank you, Elle. Yep.
Well, first, I'd like to thank Bob for this incredibly helpful conversation. Fascinating.
Yep.
So the nice thing about these events is there's always time. There's the bar is coming back open. There's coffee. There's dessert. I will say the whole purpose of bringing students to alumni events and making sure they happen at the same time is to make sure those conversations that really do shape careers and lives happen. So please enjoy the rest of the evening. Thank you for being here, and we'll see you in the cocktail bar.
Thank you, guys.